If very ill patients want to die, should doctors be held responsible if they help them? By Chaitanya, Parnita and Shrishni.
Euthanasia is the intentional act of causing the death of a patient who is suffering from a severe and incurable disease. According to the British Medical Association, euthanasia is illegal and can be prosecuted as murder or manslaughter in England and Wales. Some medical professionals and ethicists argue that doctors should adhere to a primary duty of preserving life. The Hippocratic Oath outlines the duty of doctors to save the lives of their patients. They are responsible for acting in the patient's best interests.
However, it is essential to question that if the role of a doctor is to act in the patient's best interests, should this just be their medical best interests? A key point in supporting the stance is that the duty of a doctor isn't just to prolong the life of a patient, but to do no harm. If a patient concludes that a life-prolonging treatment would result in more harm than good for them, then doctors should not be held responsible for supporting the patient's right to refuse.
In opposition to this viewpoint, the role responsibility of doctors indicates that the act of intentionally causing death, even at a patient's request, may be incompatible with the traditional medical ethics pillars of non-maleficence and beneficence.
But in light of this, it is incompatible with the responsibility of doctors to respect patient autonomy, also one of the traditional medical ethics pillars. Every patient with mental capacity has the right to refuse life-saving treatment. Healthcare is a fundamental right, just as is the right to die, just as is the right to choose. Helping patients want to undergo euthanasia at their request can end their physical pain and mental anguish. This shouldn't violate medical ethics.
While it is important to consider the wishes of those ill patients, we must also consider the consequences of permitting euthanasia and holding doctors responsible on doctor-patient trust. Doctors may become reliant on using euthanasia over other alternative treatments as it can be seen as easier and more effective in terms of time management. Ageist practice would dominate. Vulnerable people would be pressured to give up resources for those who are perceived to need it more than them. Currently in the UK, seriously ill patients can freely express their fears about unsuccessful treatment outcomes. How can we ensure that doctors are acting with the right intentions?
According to a paper published by the University of Bristol, euthanasia is acceptable on these grounds. Firstly, for severely incapacitated patients, the continuation of treatment must be deemed to be of no medical benefit or too burdensome. Severely ill patients can only be said to be unable to benefit from further life-sustaining treatment or find it burdensome if they are judged incapable of benefiting from further life itself. Therefore, when the continuation of life-sustaining treatment is described as being of no benefit or too much burden, the doctor must have already decided that the life of the ill patient in question is not worth living and therefore not worth prolonging. This is why euthanasia is deemed to be in the best interest of the patient. If doctors can meet these grounds and prove they are acting in the patient's best interests, we can ensure they are acting with the right intentions.
In reinforcing this idea, it is important to recognize that the patient's desire for assisted dying can be legally recorded in advance on something known as an advance decision document. This might make it easier for medical professionals to handle the complex decisions for further treatment, while also respecting the patient's wishes. Holding doctors responsible to something on an advance decision document shows that they are only acting according to what the patient wants and that they are acting with the right intentions. In conclusion, our argument in favour of not holding doctors responsible is grounded in the fact that the duty of a doctor extends beyond prolonging the life of a patient, and if a patient who is faced with severe illness concludes that further treatment would result in more harm than good for them, doctors that choose to help the patient should not be held responsible.